Okay, so first of all, hello everybody. Good morning, good afternoon. And I'm really happy that I can share a little bit about the EHDEN portal today, because I think it's a big achievement for the EHDEN project, and I think it's really something that can be interesting also for the wider community. And so just to give you a little bit of a background, the EHDEN portal was had its first release actually in June this year at the European OHDSI Symposium. But since not all of you, could be attend there, we decided, or actually Greg invited me to share this presentation again and tell you a little bit of what we do with the portal and what's the idea behind it. And so my presentation today will contain two parts. First one is a little bit of a recap on EHDEN. So if you know a lot about it, please stop me in the middle and say we know all this. But otherwise, I hope it's just a short recap to make sure that everybody's on the same page. And then in the second part, I want to focus really on the portal. And so just about myself. So my name is Julia. I work at Hyve, an SME in Utrecht in the Netherlands. We're highly involved in the OHDSI community for quite a while. At the Hyve, I'm the team lead of the real world data team. And here today, I'm presenting from my role as co-lead of the technical work package in the EHDEN project. But let's start with the recap of EHDEN. So EHDEN stands for the European Health Data and Evidence Network. And what we're actually trying to achieve is a sort of paradigm so that we can use all the huge amounts of European health data that's collected routinely on a daily basis and make sure that we can leverage this data to analyze health data. And so we do that by building a federated analysis network that contains a lot of nodes out of all those different health databases in Europe that are harmonized to a common data model, which of course is the OMOP CDM. And so eventually what we're trying to achieve here is really build an ecosystem that's self-sustainable and that will help us to create the evidence that's important to make better health decisions and provide better care and eventually help to create better outcomes for the patients. And of course, the values that you can see here on the screen, I think they really resonate with the community, because I think those are the values that are also really important for the rest of the community. So I'm not going to go into that in depth. Main objectives in EHDEN is the harmonization of data sources, because as you can imagine, the basis of this federated network is really the data sources that are all mapped to the OMOP CDM. So we're trying to set up the infrastructure for this, but also the processes, and make sure that there's a nice structure to enable this. Then the second point after the harmonization is the evidence. So we really want to, or we really do actually do that. We do a lot of studies, a lot of study-a-thons, e-thons to create evidence and publish them. So there's a lot of outcome actually also from the EHDEN project. And last but not least, we're building the community of open science collaborators. So we really attract take all the stakeholders, get them together, the patients, academia, industry, but also payers, regulators, HTA bodies, governments, NGOs, and all of the above, just to make sure that we build an ecosystem that's sustainable for long term. We have three foundational pillars that we focus on. One of them is, of course, the infrastructure, so the technical underlying, how do we really build this network, then research and outcomes that focus really on analytics, the methodologies, stuff like this, and then education and community, especially also with the EHDEN Academy that Nigel will talk about later in this talk. And in my talk, I will focus on one of the components of the infrastructure, which is the EHDEN portal, which helps you to find the relevant data partners for the studies you want to execute. Oops. And of course, that wouldn't be possible without funding. So the EHDEN project is funded by, or it's a public-private partnership that is funded by the EU and by the FPR partners. And so that helps to really accelerate the research and the development, to speed up the patient access, and to improve the patient outcomes eventually. And so just a reminder how the consortium or how the project looks. We have public partners, which contain some of the leading academic institutions in Europe, the SMEs and mid-sized companies and non-for-profit organizations. And then on the private side, we have a lot of the pharmaceutical companies that help set up this network. And so as you can see on the slide, we started in 2018. We have 1.5 more years to go. We have a lot of partners, but of course we're not able to build that sustainable ecosystem only with this partner. So we also have 2 different streams of collaborations. One of them is the data partners, because we actually help data owners all over Europe with a harmonization fund, so they get the budget to convert the data to the OMOP CDM. We have processes for this with Data Partner Call, so they have to submit some proposals, and then if they're selected, they receive the funds so that they can convert the data to the OMOP CDM. And on the other hand, we have the training of the SMEs. So these are small, medium enterprises that are already trained by EHDEN and certified so that they can execute the OMOP conversion of the data partners. So that's a little recap of EHDEN. Are there any questions on this? Otherwise, I move to the portal directly. So if there are no questions, then we can move on. I think you're probably familiar with the concept of Europe being an ocean of data and a desert for analysis, because as you know, there's a lot of there's a huge amount of health data that's collected routinely on a daily basis all over Europe in different countries, but it's not so easy to actually get access to this data for studies and for research. And so what we're trying to achieve with the EHDEN portal is actually making a step in the right direction to bring together the data and the analysis. And so what the portal does is actually it provides you with some sort of map that shows you where are the oases in the desert. So where are those institutions, the data partners that have the data harmonized to the OMOP CDM, and that you can reach out to for studies that you want to execute. And then it doesn't only show you where are the institutions, but it really gives you a way to customize your search so that you can really find the relevant, important data for the questions that you want to answer. And so some of the questions that you can answer is, what kind of data is available? From how many patients? Can I actually use this data for my research? And how do I get in contact with the collaborators? Because collaboration is obviously one of the big pillars also of EHDEN and of the community. And so this is how you execute a study. I think you're all familiar with that. And today we really want to focus on the first part. So of starting from a study idea or from a research question, and then moving to the parts of what data do I actually need and where do I find the data. And the EHDEN portal that we have built, that has 2 components, the database catalog and the network dashboard. And these are actually exactly the functionalities that you need to identify the data for your studies. So that was the vision with what we started out for the EHDEN portal. We want some sort of one-stop shop that is actually the entry point or the way you access the EHDEN infrastructure. And it comes with a lot of core functionalities for everything you want to do in OHDSI. So starting with the database catalog and the network dashboards to identify the relevant data, but also support and service desk functionality in case you have questions, study management and initiations of studies, data analytics, and also, of course, scientific publication. So you want to find where the data is, and access to the academy, which Nigel will talk about later, because obviously education is important here. And so coming back from what we actually celebrated at the European OHDSI Symposium, as I said, it's the first release. And so the core functionalities are actually implemented. So we have the database catalog, we have the network dashboards, scientific publications and academy access. And the other points we expect to be available by the end of this year, so that we have the full EHDEN portal. So since there was the first release now, we will have a couple of iterative releases till the end of the year to make sure that we have the full functionality in place. But let's go into the database catalog, because the question is, what does it actually do for you and how does it look? First, what you see here is the geographical spread of the data partners. So as I explained, in EHDEN, there's a harmonization fund that enables data partners to convert their data to the OMOP CDM. And as I also mentioned, there are some calls where people can submit their proposals. And as you can see, as part of the first 5 calls that we had 283 applications, from which 140 have been awarded. So 140 databases all over Europe have received funding to convert the data to the OHDSI. And I think during the summer there was the 6th call, and there will be one final call by the end of the year or in autumn. So whenever you think you're a European data partner and you want to be part of this network, there's still time to submit a proposal. And so coming to the actual data catalog, so what you see is an overview of the data partners that have been awarded the funding. And in the catalog, you can just browse to all the different organizations. So you see the logo of the organizations, you see the abbreviations, the name of the databases, and you get a first glimpse of where the data source is located and how many patients are there. And as you can see, currently in June, when we released, we had 67 data partners in the catalog, but as of this morning, this is already 72. And since it's mandatory for all the data partners to provide their data here in this catalog, that will just grow in the next months and years. And so I think that's also a good moment to thank the University of Aveiro or the developers from this institution, because these are actually the people that have built this catalog. And I think it's also important to mention here, Monsu is our community manager who actually helps all the data partners to make sure that the data is being added to this catalog and can be found. And so that's a tremendous job to do that, but I think we have the right people to do that. So that's the catalog. And there are actually 2 components for all the entries in the catalog. We have a database fingerprint, which is the relevant metadata of the databases, and that's actually filled in by the data partners themselves. So you have actually 5 sub-aspects that you fill information in. First of them is the database description, so that's just really high-level information about the name of the database and the institution that owns the data. Contact details we have in EHDEN, but we're not making them public because the data partners expressed the wish to not being directly contacted, but have EHDEN as a gatekeeper there. Then we have the technical details that actually provides information about the status of the OMOP conversion, because as I said, there are different calls where the data partners have been selected. So they're also at different stages of their journey from being selected to really have their data fully converted to the OHDSI. And the technical details also entail some information about the database setup and the data release frequency, for example. Then point 4 is data governance and ethics. That, of course, is also really important because it provides information about the compliance rules and provides information of, for example, if there are areas of research that data cannot be used for, or if it's allowed to contact patients in the database in case you have linked data that you would like to combine with those patients' data. And number 5, I think it's pretty self-explanatory. Publications provides examples of publications where the data has been used. So that's the metadata that the data owners fill in. And then you have the database dashboard. So I know it's pretty small, so you can probably not see that, but I have more pictures where you can really zoom in also. And what you see here is the database dashboards that are really zoomed into the data. So for all the data partners that we have the data converted into the OHDSI, we get those exports with the data that fuels those visualization. And so this is an example from the IPSI database from Rotterdam. And here you get already a nice view of the number of patients in the database, the gender distribution, age of first observation, but year of birth, all those high-level interesting aspects of the database. And so this is on the level of an individual database. But of course, you would also like to do that with different databases, which you will see in the next feature. But what I first want to zoom in also a little bit is, of course, that you can customize your search. So for example, if you're interested in a certain database and you want to know, okay, is that part of the EHDEN network? Do they have converted the data already? Then this is something that you can look for. You can look for the number of patients in the database, Or if you're interested in certain geographical spread, you look at all the databases from France, for example, or from any other country. And you can also find databases with the most recent updates in case you want to study more recent data, for example, from the COVID pandemic. So that's the filter options in the database catalog. And then there's the network dashboard, which I think is one of the really cool features of the EHDEN portal, because that gives you really nice functionality to really zoom into the data and take a look and identify the relevant data partners. And so what you see here is just the overview where we start with the network dashboard. So you see the overview of, okay, we have data from 15 countries now. We have 35 data sources from over 44 million patients. The distribution of where does the data come from, so mainly hospital, but also hospital and lab results or GPs, stuff like this. You see an overview of the countries where most of the patients come from, and combination of which data sources from which countries. And so that's from June, and also here you say there's a nice update. So we have 38 data sources now in the network, and we also have an update that we have more than 100 million patients actually included at the moment. And also here you can filter for whatever you think is relevant. You can look for certain countries. You can look for certain data source types. So for example, do you just want to look at GP data or hospital data or a combination together with the country? This is all possible, and you can really zoom in there. And then, of course, there's something that I call browse, explore, and discover, because there's actually a lot of data that you can really sniff around and really find out what are the databases that are really interesting and who are the ones that I want to reach out to. And so what you see here is an overview of the demographics, for example, the year of birth from all the different databases that are included at the moment. And you can see, for example, here the distribution of age at the first observation period. For example, if you're interested in population 60 plus, then probably this might be interesting, or this, or this. And this is just a screenshot, but if you go to the portal, you can also just really hover over this graph and then see which databases those are. And as you see here on top, there's actually much more aspects that you can look in. So data domains, data provenance, observation periods, visit, and of course the concept browser, which I think is what most people are actually using, because people are often interested to see, is this condition that I'm really interested in? Does this database have patients that have these conditions? And so that's what you can do with the concept browser, where you just fill in the concept and then you get a nice overview of the number of patients that have this condition in the different individual databases. But I think it goes a little bit too far to explain that here now. But we actually created a little cheat sheet so that you can try out all those different functionalities and answer all those different questions. When you register to the portal, you can find this on the left-hand side, and then you can just get started and explore the data that we have there. And as I said, that was the first release, so it's just the beginning. In the coming months, we expect to include much more data partners into the catalog and also the network dashboard. We will build new functionalities into the portal, implement the service desk for study requests, and we're also discussing a lot, of course, at the moment, whether we can add other data sources that are in the OMOP CDM, but not necessarily a data partner of EHDEN. So I think this is one of the conversations that we will have to continue in the future, because obviously this has a big potential to become the main source where you can find data partners that have their data converted to the OMOP CDM. And so last but not least, I would like to really welcome you to take a look at the portal. So you can just go to portal.ehden.eu. You can register your account. We have a team of people that will approve the accounts, and then you can start exploring the high quality real world data from more than 100 million patients from all over Europe. And if you have questions, you can ask them now, obviously.
Thank you, Julia. I know there's been a couple questions in the chat that have been somewhat answered, but And I know Nige is going to still talk about the Academy, but I also know that about his length of time. So I do think we have questions if anybody wants to ask specific questions about the portal. So maybe anybody wants to raise their hands, and we can maybe spend 5 to 10 minutes of Q&A. Does that work for you, Nige? And then we can move on. Okay, we have first one. Okay, Sanko.
Hi, I just probably a stupid question, but I couldn't get it from the presentation. What are the requirements in order to access the EHDEN as a platform? Do one have to be part, or who can have access to this resource?
Yeah, no, that's a really good question. So as I said, what we did in June was the first public release. So it's really available to everybody. So you can register your account, and as long as you have an organizational email, then you will be approved and you can start exploring the resource.
And is there any a thought behind how it's going to proceed further on? Is it going to be paid, or I mean, just curious? You say now is the starting process, so everyone with organizational account can access it, but how this will proceed further on? Is there any thought about it?
Yeah. So I think.
Shall I jump in, Julia?
Yeah.
Yeah. So we're looking at that currently. We have a legal entity, actually, a not-for-profit, a startup, if you like, that will take over from the EHDEN project, which ends in November 2024. So we're currently working on the operating model, the business model, if you like, of how this will be operated in the future. We aim always to keep the portal free, so everyone will be able to always use the portal, look at the network browser, data partner details, and so forth. As you can now. That will always remain free, but beyond that, in terms of being able to conduct studies, all sorts of things, that will probably be a kind of tiered approach, the difference between public and private and so forth. But we're currently working on the details over the coming and finalizing it over the coming months before we go into kind of full startup mode after the end of the IMI project.
Of course, thank you.
No worries.
Thank you. Thank you. Any other questions? There's one just, oh, go ahead. I heard somebody speak up. All right, one from later in the chat from Christina Bloomquist. How does EHDEN address the integrity of the data from these sources, its quality and conformance to data standards?
Yeah, we really have processes in place to describe that. So I think there's a lot of thought been going into, and we have developed a couple of tools that really look into the data quality standards. So we have the data quality dashboard, and we have the CDM inspection report that really has a lot of validation and verification checks. So high quality is obviously really important for us. Also, because otherwise you cannot create reliable evidence, right? So if you don't know if the data is good enough quality, so that's really something that we focus on a lot.
Indeed, a lot of data quality dashboard work with Claire Blacketer and other colleagues have been implemented also via utilization in EHDEN, and there's a couple of publications available on that too. Actually, if you go to ehden.eu, go to our publications, you'll be able to find those in our repository, as it were, for those specific ones related to data quality.